Hey guys, welcome back to the We Care podcast. I am Casey, family nurse practitioner here at We Care Primary Care.
And I'm Molly, one of the nurses here at We Care. Today we're clearing up one of the biggest misconceptions in healthcare, what an annual physical actually includes. We're also talking about why certain labs are ordered, why insurance sometimes doesn't cover everything people expect, and why some people end up getting a bill after what they thought was a free exam. I know these are questions we hear all the time, so I'm glad we are diving into it today.
Yeah, and I would say this conversation comes up a good bit. We are not taking insurance currently, but we are in the process of getting credentialed, which is great. And so a lot of times patients will come to me, well, I thought my annual physical was covered. Or why did my doctor check my hormones? Or why did I get a bill after my annual exam that I thought was covered? And those are all very fair questions. And so today we're going to kind of pull back that curtain and talk about what a physical is actually designed to do, what insurance considers preventative care, why some visits end up being billed differently, and how to make the most of your health care every year. But before we jump in, I want to say something really important because I love physicals. I think that prevention saves lives. And so high blood pressure generally gets caught during these preventative visits before it causes a stroke. Diabetes gets caught, again, with that insulin resistance that I talk about. But diabetes can get caught early before it causes super horrible complications later. Colon cancer can get caught early. Breast cancer can get caught early. High cholesterol can get caught early before someone develops, a heart attack. Like annual physicals are one of the most valuable things that you can do for your long-term health. And I think that everyone should have one every year. But where people get confused is an annual physical is not supposed to answer every single health question. And I feel like that's where a lot of people get confused. And so I feel like understanding the difference can completely change the way you go into an annual physical moving forward.
So I'll be honest here, I didn't really understand the difference before I started working in healthcare either. So I think most people assume you go in once a year, they run every lab imaginable, they tell you everything looks good, and then send you on your way until next year. I definitely didn't realize that there were different levels or tiers to, what kind of visit you would have and what lab work you would have at that visit.
Yeah, and I think that's exactly what most people picture. And I wish it were that simple. But healthcare, and especially insurance, is designed a little bit differently than most people realize. And so let's just kind of start with the basics.
Okay. So explain this to me like I'm a patient who's never really thought about it before. What actually is an annual physical? Because I think people hear annual or wellness visit, but they may not know what that really means.
Yep. So think about it like this. An annual physical is preventative care. It keeps healthy people healthy. It is designed to reduce your risk of developing disease. It's supposed to catch problems early before they become bigger problems. It's not necessarily designed, again, to investigate every single symptom that you have or that you've been experiencing, unfortunately, over the last, 3-6 months, a year. That's a completely different kind of visit.
So really the goal is prevention. You're trying to catch those problems before they become problems instead of trying to figure out why somebody is currently feeling bad.
Yep. Think about it this way. You take your car in for maintenance. They're going to check the oil. They're going to change the tires. They're going to rotate the tires. They're going to check the fluid, and they're going to make sure everything's running well. But if you start telling them, well, my transmission slips or my engine makes this funny clanking sound, you're no longer there for routine maintenance. Like now we need a diagnostic check. And so that's the way I think about preventative care. Like I want to check your oil. I want to, make sure everything's tuned up and ready. But if you start complaining about something, then we have to switch gears.
That's really probably the best explanation I've ever heard. And I think almost everybody can relate to taking their car in for maintenance versus taking it in because something is actually wrong. So during that visit, you're really looking at the whole picture, not one specific complaint.
Exactly. So I want to review your medical history. I want to see your medicines. I want to talk about your family history. I'm going to check your blood pressure. I'm going to check your weight. We're going to talk about nutrition. I feel like sometimes that is missed in some annual, physicals. I want to know about your nutrition. I want to know about your sleep because, again, those things can be very important. I want to know about your exercise. I want to know about your stress. I want to make sure that you're up to date on things like colon cancer screenings or breast imaging, whether you do ultrasounds or mammograms. I want to make sure that you're up to date on your pap smears and your cervical cancer screenings, whatever is appropriate based on your age and your risk factors. So depending on your age and your health history, and your insurance plan, there's also some preventative labs that may be recommended. But the biggest thing is, how do we keep you as healthy as possible over the next year?
So this probably isn't the appointment to walk in with a notebook full of 15 different symptoms that we've been dealing with for the past year.
Bingo. Now, I want to be really clear about that. I do care about those things 100%. Like, I need to know those things. If something is bothering you, please tell me. Like, I don't want you to not tell me. I never want you to leave an appointment thinking, oh, I'll just keep it to myself because today was just my physical.
Right.
I want to know. I want to know if you are having that crippling fatigue. I want to know if you're having stomach pain or headaches or anxiety. But unfortunately, at that point, we've shifted from prevention to diagnosing a medical concern, and neither of them are more important than the other. They just have two different kinds of care. They have two different purposes at different times.
Right. And that's where, you know, patients lack a lot of understanding in the fact that they are considered two different types of appointments. From their perspective, they're sitting in the exact same exam room and talking to the exact same provider that they've always talked to.
Yeah. And, you know, that's one of the things I like about working here is, you know, a preventative visit for a lot of patients is just the beginning of that conversation. So I may check labs that your insurance, you know, would like to cover. And again, we don't take insurance here, but let's jump forward a few months when we are taking insurance. Like, if we can check labs that your insurance will cover, like, great, let's get that done. But then again, you know, what labs insurance won't cover during a preventative visit, then we discuss those things. We move on from there. And so, you know, that preventative visit is often the beginning. So if things are great, let's celebrate it. But maybe we can catch high blood pressure before it becomes a serious issue. And, you know, it just because you come in and tell me that you're exhausted, we do your labs, doesn't mean you're out of options. And so it means that we've identified the need to keep asking questions. And sometimes that's as simple as adjusting a medication or ordering additional diagnostic testing. Sometimes it does mean looking at sleep. Again, I think it's so underrated. Sleep and nutrition are huge things. But the point is I don't believe that healthcare ends when your annual visit is over. I think that is an open door for us to explore other things that need to be explored.
It's really like the starting point for everything. You're making sure the basics look good, and if something comes up, then we're going to build from there.
Yep. Think of it like the front door. You know, sometimes all you need to do is walk in the door and you're good for a year. And then sometimes we have to dig deeper, and, you know, that's okay. Like, it is okay to not just have an annual, like, it is okay to dig deeper when the need arises. And good health care isn't about giving everybody the exact same visit. I could see 3 patients for an annual physical, and I guarantee you all 3 of them are going to go 3 totally different ways, because it's about meeting people where they're at and getting them healthier in their lives, just one step at a time.
Right. So that makes a lot of sense. And I think this is where people start getting confused. If you're already having blood drawn, most people naturally think, well, why aren't we just checking everything while we're at it?
Yep. And I hear that all the time. And someone will say, well, while you're in there, let's just check my hormones or let's check my vitamin D. And hey, can you check my cortisol? You know, what about my iron? What about my test? Like, there's always something that we want to check. And, you know, sometimes I get, well, just add in food sensitivity testing too. And I'm like, this is not the time, like, right now. And I understand why people ask. Nobody wants a needle jabbed in your arm, you know, 3 different times. But if you're already getting blood drawn, it feels logical to check everything. But that's one of the biggest misconceptions. There's preventative screening labs and there's diagnostic screening labs. And, you know, understanding that will make your life, your healthcare journey, and honestly, insurance much easier.
Right. So break those down for us. What's the difference between preventative labs and diagnostic labs?
So I kind of tell patients this, like, insurance doesn't ask what would be interesting to know. They don't care. They ask what has been shown to be beneficial for screening healthy people. And those are two totally different questions. And so, it's common to screen for most diseases that affect large populations, things that we know early detection can make a huge difference.
So during a routine annual, what kind of things are we actually screening for?
We're going to ask, do you have diabetes? We're going to ask, are your cholesterol levels elevated? We're going to check, are your kidneys functioning well? Do you have evidence of anemia? How's your liver? How's your electrolytes? Depending on your age and your risk factors, what does your hepatitis C or HIV status look like? Those are the types of questions that preventative screening is designed to answer. And the goal is to identify, again, those big diseases that can wreak havoc over time.
So again, two people could both come in for annual physicals and both leave with a completely different set of lab orders, and that's totally normal.
Yep, because prevention, again, isn't a one-size-fits-all, and I'm doing you and everybody a huge disservice if I treat it as such. And so, it depends on your age, your sex, your lifestyle, your genetics, your personal history, your family history. And unfortunately, sometimes it depends on your insurance plan. And that's where you have to just kind of learn to tiptoe in the insurance realm and, do what they say. And then we dig deeper, from there. But two healthy adults are not ever going to have the same treatment plan.
Right.
And the same screening recommendations.
Right. And like you had brought up earlier, it really is. People are like, oh, you already got a needle in there. Can we just go ahead and add this and this and this and this?
Yep.
And that's just not the way it works.
Right. And the thing about it is those numbers can be really important, right?
Mm-hmm.
Like, just because a test isn't part of preventative screening doesn't mean that I don't want to see it.
Right.
But it also doesn't mean that everybody needs it either. And so it simply means that we have to ask different clinical questions for each patient. And so if someone comes in feeling completely healthy, 0 symptoms, minimal family history, current guideline or current preventative guidelines completely up to date, they don't, recommend checking an A1C, a cortisol, or a full, hormone panel. That's not what you need. But those aren't bad tests. Mm-hmm. They just aren't designed to treat or designed to diagnose healthy populations, right? So again, that's when you have to answer specific medical questions based on patients' histories.
So it's really less about ordering more and more tests. It's more about ordering the right test based on what's actually going on.
100%. Let's take fatigue for an example. So you come in, crippling fatigue, 6 months, year, whatever. Well, now I'm trying to figure out why. Like, we're no longer prevention at this point. Like, you have a complaint. So we need to dig into your iron. We need to dig into ferritin. We need to dig into B12. We need to dig into thyroid. Like, do you have sleep apnea? Do you have depression? Like, there are so many things. There's dozens of possibilities that are there. But at that point, I'm no longer screening a healthy person. I'm evaluating a symptom. And so that's when additional testing needs to be done because we have a very specific clinical question that we're trying to answer.
Right. So when somebody asks, can you check my vitamin D? The answer isn't automatically going to be like a yes or no. It's going to depend on why they're asking.
Yeah. And that is a big thing. Like, are you having symptoms? Do you have a history of low vitamin D? Have you ever had your levels checked before? Is there something in your history that makes that test useful is kind of the biggest thing. And so my goal is never to order the most tests. My goal is to order the right test for the right person at the right time.
I will say I do that in, I'm more in the aesthetics, but my goal isn't just to overload you either in the aesthetics world. It's to do what is customized to you.
Yeah.
I really do think that we've kind of gotten into this mindset where people just assume more testing automatically means it's better health care, and that's just not the case.
Yeah. Sometimes more testing gives us valuable answers. Like, don't get me wrong. But sometimes it creates unnecessary confusion. False positives, extra cost.
False positives.
Right. Like, I can't tell you how many times somebody's brought to me a like autoimmune panel, and they were positive at one point, and then we recheck it and they're negative, and they're like, well, why did you need it checked?
Right.
It just creates a lot of confusion. And so the right test for one person is not going to be the right test for every person. And so again, it's very personalized.
Yes. So I think this is probably, the question that a lot of people have been waiting on to be answered. But why do people sometimes get a bill after what they thought was supposed to be a free annual physical?
Yeah, most people, I feel like, aren't upset because they got a bill. They're upset because nobody really ever explained why they got a bill. Because you go in thinking, I owe nothing.
Right.
I just had my annual well woman exam with my OB. And if I would have gone in there complaining of something, it would have moved from a regular GYN OB visit to a, diagnostic visit. And so, again, people are upset because they never explain, well, I just need you to know, like, this is now moving from a preventative visit to a diagnostic visit.
I have to code this a different way.
Yes.
So give us an example of what you would see.
Yep. Okay, so let's say you're going in for your well woman exam. Everything starts exactly as planned. Blood pressure's fine, weight's fine. We talk about nutrition. We talk about sleep. I order, we do your pap smear. We do all the things. And then right before I leave the room, you say, oh, well, I'm here.
Ooh, every provider just felt that one a little bit.
Yeah. While I'm here, I've been exhausted for 8 months. While I'm here, I've been having chest pain. While I'm here, I've gained 30 pounds and I don't know why. And while I'm here, my anxiety's gotten worse. Mm-hmm. Again, everything was fine until that. And again, I don't ever want you to hide it from me. I want you to tell me those things. But we're no longer in the preventative care. Like, now we're evaluating a medical concern.
Right. It's almost like halfway through the appointment, we've switched gears and we just, can't have to understand that it's now a different type of visit.
Yeah. And, sometimes, it feels like I'm just here. Let's just do everything. And that's what makes sense. And unfortunately, that's just not it.
Right. And we understand that that's where things get confusing. It feels like it's all just one visit, but in the healthcare world and in the coding world, it's where the changes kind of kick in.
Yep. And, it's unfortunately just how insurance is designed to work. Sometimes it's not specific to here. It's not specific to your doctor. It's just insurance, unfortunately.
Yes. So let's try to wrap this up a little bit. If someone only remembers 3 things from today's episode, what do you want them to take away?
Don't skip your annual physical, because prevention saves lives, helps us catch problems early, often before you ever have symptoms. And then not every blood test is considered preventative. So it doesn't mean it's good or bad. It just simply means we're asking different questions. And please tell your provider, this is the third thing, please tell your provider what's bothering you. Sometimes it can be addressed during your annual visit. Sometimes it deserves a dedicated follow-up, but either way, our goal is to partner with you in your health.
Yes. So honestly, I learned a few things today too, even, since working in healthcare. Some of this isn't always obvious until someone explains why. So I think that's why this conversation was so helpful.
Yeah. Healthcare can feel complicated, but it doesn't have to be confusing.
Yes. Thank you so much for hanging out with us today for another episode of the podcast. If this episode cleared up some confusion for you, share it with somebody who's ever wondered what actually happens during an annual physical. And make sure to subscribe and follow We Care Health and Wellness for more education and behind the scenes content. And don't forget that at the end of the day,
we care. See you next time.